the theme of my talk is going to be how digital technology is transforming medicine. Because I'm a neuroscientist and also because I've had a special interest in virtual reality technology, I'll also be talking about the neuroscience of why digital technology is having such a profound effect, and also the opportunities afford us with the new technology of virtual reality and augmented reality technology. So as Juan mentioned, I have an academic center of gravity at the Stanford University Virtual Human Interaction Lab, where we're doing basic research on virtual environments and how they can shift behavior and attitudes. But I also have a clinical emphasis and work with Stanford Healthcare and the National Mental Health Innovation Center at the University of Colorado. I have had a long time interest in how we have oncoming crisis because of an aging population, and how we must really rise to the occasion to develop new technology to address this ongoing looming crisis. In the US, for example, our population has doubled since the 1960s, and we're very top heavy with many more seniors in their 70s, 80s, and 90s, with fewer number of children to support them. With a top-heavy situation as this and chronic healthcare conditions, we have maybe 10, maybe 15 years before there will be a tremendous healthcare crisis, economic crisis, unless we do a better job of coming up with interventions to support chronic disease management and also aging in place. Fortunately, there is hand-in-hand with this a revolution going on, a digital health revolution that is transforming healthcare. And it's really a shift of emphasis of where the patient care is occurring. With the evolution of wearable sensors and mobile health technology, we're shifting the focus and locus of care, whenever possible, away from the clinic, away from the hospital, but to where the patient is located. And we're leveraging cell phone technology, laptop technology, and wearable sensor technology to come up with a new way for clinicians to work with patients and help maintain their health, and also a new way for individuals to manage their own health and wellness in a preventative manner. And it's really the full stack of all aspects of healthcare that are being affected by this revolution, starting with prevention and wellness, improved assessments, more functional training systems, improved interventions, clinical interventions, new methods to facilitate adherence to the sometimes difficult clinical protocols, and also now new ways to reach people who are in outlying areas and otherwise would not have proper access to healthcare. In the last 10 years, every medical device has been reinvented and moved from an analog, handwritten world to a digital world, ranging from blood pressure monitors to sphygmometers to thermometers, and to some extent the way we interact with our clinicians has been digitized too. We're also entering a new era of medical wearables. Many people have smart watches, but it is going beyond that. We're now coming up with a generation of sensors that can be implanted or worn like band-aids on the surface of our skin that can collect a tremendous amount of data about our health and transmit that up to the cloud for further analytics. And it's not just the physical parameters of our health that are being impacted. We're also coming up with new ways to measure and index our cognitive and emotional status. We have brain health biomarkers that can be identified by looking with people opting in to sharing their passive data from their smartphones, how fast they're typing, where they're going, who they're interacting with. We have voice analytics that can serve as a biomarker for anxiety and depression. We can collect facial expressions and use that as a score for emotional state and cognitive state. And using the sensors in our smartphone and augmented reality systems, we can do dynamic challenges that can do a fantastic way of measuring our cognitive function. All this feeds into quite amazing, powerful system of cloud-based analytics, where we can have a system where data is being collected from the individual through the wearable sensors and passive data collection that I mentioned previously, uploaded to a cloud where there is machine learning analytics to look at both individuals and also population trends, and then ways to share that information with the clinicians, with the healthcare administrators and government officials, and also push and pull information from the individual in a way that is robust and personalizes the clinical intervention for the individual. Of course, an important aspect of this is protecting patient confidentiality and security. And with blockchain and other methods, we're getting better at maintaining that, having both the benefit of personalized medicine, but also personalized security. One of the things I'm really excited about is we're also seeing a new era of combination therapy, where we combine digital app-based systems with medication and use the digital apps not just to provide additional therapeutic value, such as cognitive behavioral therapy, for example, but also to track adherence, utilization, and the efficacy of the pharmaceuticals. This feedback loop allows us to tailor the intervention specifically for the individual. And again, I want to share with you my passion, which is how we can use a very powerful emerging wave of new ways of interacting with each other and with information, which is virtual reality and augmented reality technology. This will have a profound effect upon and be an important pillar of this digital health revolution. Right now, and we tend to use the term XR technologies or extended reality technologies to talk about the spectrum of immersion. Virtual environments are fully immersive. Augmented environments overlay computer information and graphics upon the real world. And we often will have mixed environments where we're interacting with the information and interacting with the real world. So to make it a little bit easier, we use the term XR technologies to talk about this full spectrum of immersion. And we're really just at the beginning of the emergence of this technology. It's very powerful, but it's picking up speed, and in a few years it will be even more profound. XR technologies are currently in the middle of disrupting a variety of enterprise applications, education and training, manufacturing, product design. But healthcare is one of the main areas that I believe will be more profoundly impacted as these technologies migrate from where they are right now, which is in the computer gaming and entertainment arena, over to the enterprise. And again, it's all aspects of healthcare are being affected with the evolution of this technology, starting at health and wellness and going across assessments, training, interventions, methods to facilitate adherence, and ways to reach outlying populations. At last count, I added up more than 200 startups that are working in medical AR and VR companies, and almost every sector of medicine is being impacted. As a matter of fact, I have yet to find a clinical area that has not had some new products being developed that leverage AR and VR technology. We're also seeing a significant amount of investments in this arena. The market is projected to be $5 billion this year, and there's a number of large players already getting involved. Hewlett-Packard, United Health Group, some of the leading academic centers are making a stake on utilizing VR technology, and we already have one company that's a uniform with a multi-billion-dollar valuation, Mindbase. And there's many expensive problems in healthcare that the technologies are making a big difference in, ranging from helping us with weight management and smoking cessation and dealing with alcohol and substance abuse addictions, chronic pain, stroke, autism, post-traumatic stress. So some very profound and important clinical areas are being impacted by the technology. We have several academic conferences focused on this, and a organization, the International Virtual Reality Healthcare Association. So let me jump in to talk about the neuroscience of how VR promotes behavior change. Because of the ability of VR technology to engage us cognitively, we could activate neuroplastic changes via leveraging the brain's reward systems, our interest and attraction to novelty, to social interaction, and our mirror neuron systems. Because VR and AR technologies are much more attention gathering, we're able to do a much better job, for example, than imaginal therapy by doing in vivo exposure techniques using VR technology to do exposure therapy to treat post-traumatic stress, to treat phobias and anxieties. We can also leverage our mirror neuron systems we have an ability to change our behavior by showing us our future self and giving us feedback about how our day-to-day behaviors. We may not always be very conscious of how what we do in terms of nutrition and sleep and our behavior, how they impact our future. But by creating an avatar of our future self that can interact with us and talk to us, maybe call us up on the phone if we do something that perhaps we want to avoid doing, we can leverage that ability to have empathy with our future self to help us shift our behavior. One of the reasons VR and AR technology is so profound is that we're able to leverage our interest in narrative story. We're such social animals, and we are always looking for a narrative, as in particular a narrative in which we're a part of the journey. And our brains are wired to search for and to place ourselves in the middle of a story. One of the profound aspects of VR and AR technology is that we can create a context for our healthcare that helps provide relevance, promotes our own engagement and participation in our own healthcare journey. And as you know, sometimes it can be a difficult journey. Healthcare is arduous and boring. But by the use of VR and AR technology, we've shown that we can promote adherence to sometimes difficult clinical protocols. So let me start by jumping into showing you exactly how VR and AR technology has been applied. I'll start with the zone of training, where we can do much more functional training as opposed to some of the traditional book-based learning methods. We can do simulations that are used to teach surgical skills, for example, how to use a specific piece of clinical equipment, or we can have teams get together and practice how to respond to an emergency procedure. We can have a group of surgeons train another surgeon, perhaps in a remote area, that needs to study up fast on how to do a procedure they haven't done before, by leveraging VR and AR technology to provide training in a telepresence manner. Already some medical schools are using VR technology to supplant the use of cadavers and teach anatomy and physiology. We have virtual patients that you can practice your bedside manner on, and perhaps learn how to do the difficult chore of how to deliver bad news about a clinical diagnosis. We are able to do a better job of assessments, leveraging AR and VR technology, more objective assessments as opposed to subjective paper and pencil presentations. In many research labs and other places, people like to show this scene that might be familiar to some of you of walking out onto a plank. And the purpose of that is to show how, despite the fact that you know you're in a research lab and talking to your friends, the VR systems are so profound that they can create a feeling of anxiety. By being able to create a cognitive state, we can teach people the skills to manage that cognitive state. The ability of VR to provide us with a standardized situation allows a new form of diagnostic assessments that are not based on imaginative questioning or recall. We can have an experience to study how people respond to that. And not just in a cognitive way, but also how we can measure our movements and come up with more objective measurements. We're also able to capture new information such as facial expressions in a standardized virtual environment to help us do a better job of that diagnostic process. We're starting to do a combination of VR with brain imaging so that we can see how there's a correlation between the functional response to a stimulus and personalized medical interventions based on an individual response. The ability to use VR to generate a cognitive state allows us to push better assessments out into primary care. So let me give you some further examples of how VR and AR are currently being used. We're using them for preoperative planning and image-guided surgery, to do stroke and physical medicine. As you know, our mental health care system is often backed up, so many of the interventions that we're seeing using VR and AR technology is in the zone of mental health care. We use VR as a method to distract from painful and uncomfortable procedures, to use exposure therapy to help with phobias and post-traumatic stress and other anxiety disorders. We can use VR to teach people the skills they need to resist peer pressure and resist their cravings. We can teach situational confidence and practice refusal skills. There's a whole list of areas within behavioral medicine where VR has shown to have a very positive impact, ranging from dealing with psychosis and anger management and obsessive compulsive disorder to depression, attention deficit disorder, autism spectrum disorder. There's almost all aspects of psychiatric and psychological care have been impacted. And we're seeing the evolution of products that aren't just one particular product for one particular indication. We're seeing the evolution of platforms that can be used to address not just a specific diagnosis, but to also be used to promote general health and wellness. And again, any of the problems that our seniors have can be addressed by using VR. And in today's world of COVID-19, the use of VR allows us to connect seniors to their families and provide, even when they're in isolation, engaging experiences. And of course, for palliative and hospice care, VR can have a profound impact to help people have experiences that otherwise they would not be able to have. We're using VR preventatively to promote adherence. Again, we can leverage a dialogue with our future self to help people understand the results of their behavior and the choices they make and their adherence to medication. And because VR allows us to have a portable product, we can reach out to underserved areas in a telemedicine manner. Again, I'm pretty excited about the fact that we can combine technology with other established methods of clinical care and come up with a digital health platform that promotes adherence and improved interventions. The analytics that we'll be able to do as we use these systems will only allow us to get better at the therapeutic interventions. There's, again, a number of large sectors of medicine that are being affected today by this technology. They'll only be more profoundly affected as we move forward. There's some areas that have more activity than others, such as stroke and traumatic brain injury, distraction for painful procedures, etc. But there's also some areas that are extremely important that are relatively undeveloped, and we can expect to see further activity moving into helping with better cognitive assessments, depression, helping with addictions, etc. So let me summarize, and I apologize, I've had to compress what's normally a very long talk into a short amount of time. I hope I've come across in detail. We've had a recent surge in digital therapeutics applied to medicine. We have more than 30 years worth of research and development, and finally some of these interventions are escaping the research lab and being used in clinical care. The cost of digital health technology has gone down tremendously, and now these new technologies are becoming much more affordable. I think we can extrapolate that with the passage of time, these new technologies will move out and become more ubiquitous, informative, and integrated into the healthcare system. And I'm excited about the fact that many of these interventions I've talked about do lend themselves to better senior care. And I hope this will help us address the ongoing crisis that we know is looming in senior care. Well, thank you very much for your time.